Sharifah and Dr. Azmani, our Pathophysiology lecturers. I am Sharifah Miza and we are Semester 3 students from the Bachelor of Dietetics would be delivering a video on the topic of breast cancer. According to the Center of Disease Control and Prevention (CDC), breast cancer is known as a disease in which cells in the breast they grow or multiply out of its normal cell replicating rate. Breast cancer can begin in different parts of the breast, and most breast cancer they begins in the ducts or lobules. This is the anatomy of the breast. Women's breasts are made up of specialized tissue that produces milk, which is called the glandular tissue, as well as a large amount of fatty tissue which determines the size of the breast. As for the milk-producing part, the breast is organized into 15 to 20 sections, which is called lobes. Within each lobe, there are smaller structures called lobules, which is the site of milk production. The milk then travels to a network of tiny tubes called the ducts. These ducts connect and come together into larger ducts which eventually exits the skin through the nipple. The duct area of the skin surrounding the nipple is called the areola. The presence of connective tissue and ligaments provides support to the breast as well as provides its shape. Similar to other organs, the breast also contains blood vessels, lymph vessels, and lymph nodes. Breast cancer usually begins in the ducts that carry milk to the nipple called the ductal carcinoma or within the lobules called lobular carcinoma. In some rare cases, other types of cancer can also occur in the breast, such as lymphoma, which is the cancer of the lymphatic system, or sarcomas, which is the cancer of soft tissue. Who usually gets breast cancer? Studies have shown that the risk of getting breast cancer is due to a combination of factors. The main factor that influences the risk of getting breast cancer includes being a woman and getting older. Most breast cancer are found in women who are 50 years and above. It is also proven that men can also get breast cancer but not as common as in women. This rare condition usually happens in men with Klinefelter's syndrome. How big can this cancer be? Breast cancer lumps can vary in size. Typically, a lump has to be about 1 centimeter big, which is about the size of a large pin, before a person can feel it. However, it depends on where the lump starts to grow, how big the breast is, and how deep the cell growth is. How dangerous this cell cancer can cause to a particular person. This breast cancer can often start out to be small, but as it grows, it can spread throughout the breast or other parts of the body. This can cause serious health problems and death. Breast cancer can also spread outside the breast through blood vessels and lymph vessels. When it is spread, this breast cancer is said to be metastasized.
Next, I will proceed to the breast cancer symptoms or signs. The signs of breast cancer can be divided into two, which are early signs and later signs. For early signs, the patient can identify the cancer if a new lump or mass and breast pain called mastalgia that does not go away after the next period occur. A painless and hard mass that has irregular edges is more likely to be cancer, but breast cancers can be tender, soft, or round. Mastalgia is usually categorized as either cyclical or non-cyclical. Cyclical pain means the pain is associated. The menstrual cycle tends to subside during or after the period. Non-cyclical pain can have many causes, including injury, and may come from the surrounding muscles or tissues rather than the breast itself. Next, nipple discharge from one breast that is clear, red, brown, or yellow is one of the signs of the breast cancer. The unexplained redness, swelling, skin irritation, itchiness, or rash on the breast are also the early signs of the cancer. Furthermore, the later signs show retraction or inward turning of the nipple. The enlargement of one breast and swelling of all part of the breast, even if no lump is felt, shows the later signs of the cancer. The enlarged lymph nodes under the arm or around the collarbone and causing a lump or swelling even before the original tumor in the breast is large enough to be felt. Lastly, the visible vein on the breast is one of the signs too.
As stated in the slides before, breast cancer is a disease in which cells in the breast grow out of control. The breast is considered the primary tumor site where the first cancer lump is diagnosed, stemming from the breast duct or lobes. It is probably spread through the bloodstream. The affected lymph nodes will become swollen and enlarged. When cancer comes back after treatment, it may return to the same place, which called recurrence, as it is not a new cancerous cells. But the recurrence can also appear in a place not directly related to the first breast cancer, and this called metastasis or called as secondary tumor. The cells break away from primary tumor and invade the surrounding tissues. But first, the tumor cells need to leave the vessel system and then it can invade the tissue. The cell tissue must attach itself to a vessel's wall. Once done, it will work its way through vessel and enter the tissue. It commonly spread to the liver, brain, bones, and lungs. With most breast cancer, each division usually takes 1 to 2 months.
The risk factor of breast cancer can be divided into modifiable and non-modifiable. For non-modifiable, firstly, female has higher risk about 100 times than men. Men can also develop breast cancer but at a very low risk because they have less estrogen and progesterone level. Besides genetic risk factor, some of the breast cancer are thought to be hereditary because they are carrying of genetic mutation breast cancer type 1 and 2, which at higher risk to develop breast cancer. In normal cells, these genes help prevent cancer by making protein that keep the cells from growing abnormally. Next factor is aging. It is important to have a mammography screening in women aged 45 and above because risk of developing breast cancer increasing with age. Then, family history. Women who has a relative with breast cancer are prone to this disease than women without any affected relative. For modifiable factor, firstly, alcohol. Consuming alcohol more than 10 grams a day at high risk to develop invasive breast cancer because it will increase the level of estrogen in the blood. Next, breastfeeding. Breastfeeding can reduce the risk of developing breast cancer as decreasing in the estrogen level and it will stop the ovulation. Factor number 3 is radiation exposure. Radiation at certain wavelength called ionizing radiation which can damage the DNA in cells leading to potentially serious effects including cancer. Next factor is obesity and overweight. Most studies found that breast cancer is less common in countries where the typical diet is low in total fat and in women who limit the intake of dietary fat. Last factor is hormone replacement therapy. HRT will increase the estrogen and progesterone level in the body which can promote to breast cancer.
Breast cancer diagnosis can begin with self-examination. Young women of all ages are encouraged to perform self-breast examination at least once a month, so us women can be more familiar of how our breasts look and feel, as we can be more alert if there are any changes that need medical attention. Any lumps, dimples, discoloration, textured, leaky nipples or misshapen notice, we need to alert our doctor as soon as possible. So, as you can see from the screen, there are different approaches to diagnose breast cancer which involve both invasive and non-invasive procedures. Let's start with the non-invasive procedures. Firstly, we have mammograms. Mammogram is an X-ray that allows medical specialists to examine the suspicious area of the breast tissue. It is a machine designed specifically for the breast examination. Well, there are two types of mammograms. One, screening mammograms that detect breast cancer in women with no symptom, and then they can proceed with diagnosing mammograms after a suspicious result from the screening. If the results are still suspicious from the mammograms, the doctor may suggest ultrasound of the breast tissue. The images generated by the ultrasound is called sonogram, and it can provide evidence about whether the lump is a solid mass, a cyst filled with fluid, or a combination of both. Next is MRI. In case the initial exams are not conclusive, the doctor may recommend a breast MRI to assess the extent of the disease. MRI uses radio wave through the breast tissue, producing detailed images within the area of the breast tissue. Let's proceed with the invasive procedure. Invasive means there will be a little bit of wounds involved. So firstly, biopsy. A breast biopsy is a test that collects samples by removing the tissue or fluid from the suspicious area. The samples are then examined under microscope and further tested to check whether there are presence of breast cancer. A biopsy is the only diagnostic procedure that can definitely determine if the suspicious area is cancerous. If a patient is diagnosed with breast cancer, the doctor may order additional lab tests to assist with the prognosis. The two most common lab tests are the hormone receptor test and the HER2 or NEW test. Hormone receptor testing is performed by immunohistochemical assay that involves specialized staining process on the sample to see if the hormone receptors are present, while the HER2 NEW test looks for a specific kind of protein that is found with certain types of cancer cells and the gene that produces it. This test is often ordered in conjunction with the hormone receptor test. This test can be performed by using the biopsy sample, or if there are no biopsy sample, they can use blood test.
So, how the breast cancer can be treated? There are 3 treatments of breast cancer that I want to focus, which includes surgery, radiation, and breast reconstruction. The surgical options for breast cancer include breast conservation surgery and mastectomy. Breast conservation surgeries include lumpectomy, segmentectomy, and quadrantectomy, which require removal of the tumor with preservation of the majority of the normal breast tissue. Mastectomy involves surgical removal of the entire breast. Next, the radiation therapy involves exposure of the cancer to high-energy ionizing radiation, which causes cellular damage, with breaks in DNA in the targeted cancer cells and disruption in the DNA template. The most common types of breast reconstruction are non-autologous fixed volume or tissue expanding implants, and autologous procedures such as TRAM flap, latissimus dorsi flap, and DIEP flap. Fixed volume of silicone gel-filled implants are used for reconstruction of smaller breasts at the time of mastectomy if a tissue-sparing procedure have been performed. More than half of all cancer patients receive radiation therapy, and breast conservation surgery followed by radiation has been shown to be equal in effectiveness to mastectomy alone. Radiation is also recommended following mastectomy, in which 4 or more positive axillary lymph nodes or an advanced primary tumor has been identified.
For diet and nutritional requirement, food that can help the patient's health such as fruits, vegetables, and serving that rich in antioxidant. Limiting the intake of fat and red meat, because if it is too much, it will worsen the health of the patient. Adding sugar and alcohol will increase the risk of getting breast cancer because it will raise the estrogen and progesterone level in the body.
Thank you very much for listening to our presentation on breast cancer.